Good morning, everybody, and thank you for joining. So this morning, I want to give you a brief introduction to a solution on privacy-preserving proximity tracking. When the pandemic hit us, there are many people who had ideas how we could use technology to actually deal with these challenges. And we saw the first developments in Asia, where actually effective technologies were deployed based on smartphones, but they were not particularly privacy friendly. So for example, in Korea, a system was developed where the trajectories of infected people were shared with everybody else. And it was claimed to be anonymous, but of course it was obvious that you could identify people from this. So when we saw this development with a group of researchers in Europe, led by one of my old students, Professor Troncoso at EPFL, we decided to make a privacy-preserving proximity tracing solution. So we wanted to show that technology can help to actually do contact tracing without violating privacy. Just because this is a seminar on contact tracing, I want to give a brief introduction of the strategy. I guess most of you are familiar with this, but more or less with COVID-19, there is 3 stages. Those lucky of us who are not infected yet. Then people get infected and they're contagious, but in fact they have no symptoms. And unfortunately for COVID-19, some people never exhibit symptoms. But most people actually, after a while, get symptoms. Now, of course, if one does nothing, the virus will grow at a very high rate. And within a very short time, we will have the whole population infected. And of course, also the healthcare systems overloaded with many fatalities as a consequence. So in a normal strategy, you will isolate people who have symptoms, but then you will always be one step too late, because in fact, those people have been walking around and infecting other people for several days. And by the time you isolate them, they actually have already infected other people. And again, the epidemic will grow very quickly. So in an effective contact tracing solution, what you have to do is to find out who are the contacts of infected people in the past days. You have to go a while back and isolate or quarantine those people. So quarantine them, and then, this way you will quarantine more people, but you will be able to. It has been demonstrated that this is indeed effective. But so we have to be faster than just isolating people with symptoms or with a positive test. We have to quarantine people with high-risk contacts with somebody who had a positive test. We have to go back in the past. So this is essential to control epidemic. Of course, you can only do this if your testing capacity is sufficient, if the overall system to treat people is sufficient, you don't have a breakdown. And of course, you need support in society as well, because contact tracing requires that people collaborate. So historically, we only had manual contact tracing, where people were being contacted today by phone, in the past only in person. And where you asked about your contacts in the past 7 days, this is of course highly privacy invasive, because you have to tell another human being what you've been doing, and some people are reluctant to do this. It's not particularly fast, because it may be hard to reach people. These interviews take time, and people also cannot remember everybody. And of course, if you had a contact with strangers, say in public transport, you were sitting next to somebody on a train or bus, or maybe in a bar, you actually may not even know the name of the people or the phone number, so you can't actually help. So this was the idea, to do this with an app. And as I explained to you, in Asia, people made apps that were pretty effective but highly privacy invasive, and would not be compatible with European values, and also not with our legal framework, which is the GDPR, which actually requires privacy by design, which says that you should collect only information for a specific purpose, but not more information than specifically is needed. A big advantage of an app is it can work faster, so you can actually inform all the contacts within a short period of 12 to 16 hours. And of course, what you require is that it's more accurate. It also works with strangers, so you actually don't have to know the name of the person. It's sufficient that a fraction of the population that's large enough has the app. Of course, one doesn't include the other. It's clear that we all be people without an app, and there is people that can be found by the app, but not by manual contact tracing, and vice versa. So it's not an idea of having a miracle tool, just an app, and we'll have contact tracing perfectly working. Both are complementary, and we will always need manual contact tracing on the one hand and an app on the other hand, and they work together. So such an app needs to be sufficiently accurate, so it needs to identify intensive contacts, not temporary contacts when you pass somebody in the street or when you pass somebody or you sit next to somebody at a sufficient large distance. So you want accuracy in terms of false positives and negatives. You also want security in the sense that you want to prevent people from reporting false infections, because so you could get, for example, in schools or in companies, people who falsely report that they're infected, and then a large number of people have to go in quarantine with a very big societal and economic cost. We want a scalable solution. A solution should also be transparent. We believe that we have to build public confidence, so we should show how the solution works, and we should have independent experts be able to review the solution. We also believe in making things voluntary. Again, in Asia, in some countries, this app is mandatory, but of course, such a mandatory app can be bypassed in many ways. You can just switch off your phone at some moments. You can leave your phone at home. You can have 2 or 3 phones. And so really mandating such an app is not a good solution. We should actually get the collaboration of the people. And of course, it shouldn't take months and months to develop this, or at least a year. So these apps were rolled out quite quickly. So in the course of March, we made an informal consortium with about 30 researchers, not only computer scientists, but also legal people, epidemiologists, and we developed a solution. We also started talking to Google and Apple, who had related ideas, and we aligned our ideas, and we made sure that Google and Apple would support our ideas in the smartphone, because it turns out that to implement these apps with a low battery consumption, you actually do need support from the operating system. And as I mentioned, our solution is based on privacy by design. We share only minimal data. For example, we do not use location data, because there is studies that show that if you share location data of a person at 4 times of a day, you actually identify this person uniquely. So there is no such thing as anonymous location data unless you aggregate this. But for contact tracing, you cannot work with aggregate data. You have to work with individual data. And so individual location data can just not be anonymous. And so we were all unpaid. We were all working for the benefit of society, but we were very pleased that more or less 6 months later, we can now say that our solution is a European-wide de facto standard, and there is work on the way to actually make the app work globally across all member states and regions in Europe. So here is the situation of the deployment right now. So it's deployed in 18 EU countries and Switzerland, also a number of countries outside the EU, like US states, a few countries in Latin America, also Japan and Saudi Arabia, but I focus here on the EU. So we have about 45 million downloads, and you see that the highest adoption rates are in Ireland and Finland, where they're around 40%. Then this next level is Denmark, Switzerland, Germany is around 20%. And then there is a number of countries which are more around 10%. And Netherlands, Spain, Belgium, it's below 10%, but in those countries, the rollout has just started. Also interesting is that France has chosen its own approach, where more information is being collected centrally. They have a very low adoption for technical reasons, but maybe also because of lack of trust. And of course, the disadvantage of this choosing your own approach is that the app in France will not interoperate with the app in the other countries. So each of those countries has developed an app or built an app based on someone else's country, but every app is customized to take into account specific issues of the national or even regional health system. And there is also slightly different features in the app, but as I will explain, these apps will be able to interoperate. This, I think, is by itself already a very big success. And we hope, of course, that in the next months, this will further grow. So if all deployments will be completed, we could get close to 70 or 80 million downloads. So a very big misunderstanding grew in April, because a study of Oxford University was quoted in the press as saying that you need 60% adoption of the app to make it effective, which is more or less not realistic, because in most countries, only 70 to 80% of the population has a smartphone. This study was misquoted, and even the original researchers complained about this. This was a very unrealistic study because it assumed uniform distribution rather than the distribution in certain social groups or certain organizations. It also assumed there was no manual contact tracing. So since then, people have made better models. And we know from several studies, for example, in Switzerland and Germany, that indeed an app can identify rather quickly in new cases, which manual tracing cannot identify, even if adoption rates are in the, say, 10 to 20%. And also, some studies have shown that the app can be particularly effective if small groups or certain groups, like, for example, a university or a large company or a government department, have a very high adoption rate, say 30% or higher. So the goal is not to have a very high, it would be great if, of course, you can get a very high adoption population, but it's sufficient for the app to be effective if you get a high adoption rate in certain social communities. So a few words on how the app works very briefly, without going too technical. Everybody installs the app, and the app is based on Bluetooth. So it doesn't use any other location data, it just uses Bluetooth signals. It sends signals in the background while your phone is in your pocket, and your phone does not have to be on, so the screen can be locked. It just sends random codes out in Bluetooth, and it also listens on a regular basis for these codes, and it just stores these codes. So these codes give no information on your name, on your phone number, or anything else. It's just random data that your phone collects. It gives no information either about whether you're sick or not. If you get symptoms, you may get tested. In the Belgian case, you then give some code of the app to a doctor, but this is different in many countries. Then, of course, you get the test, and in Belgium, the test result will appear in the app. And then you ask the question, if you have a positive test, whether you want to share your data with other users. And in that case, you will upload the codes you have sent out in the past 7 days to a central server. So you get an authorization to do this, and you put those codes in the server. Again, you don't put your name there. It's just random codes that actually are anonymous, or if you want to be really correct, pseudonymous, but that are very hard to track them to yourself. Then once a day, or in some systems several times a day, all the apps download those infected codes from the server. So they will just download them, then they will go look in their storage whether they have received such an infected code. So here, the green phone only has codes from the yellow phone. Of course, he doesn't say where they're from, but he will not find a match. But here, the yellow phone actually has received a blue code. And so it has gotten information from the central server that this code actually is a code from an infected person. Then some analysis will be done to find out whether this person was close enough, less than 1.5 meters, during a long enough time, about 15 minutes. And if this is the case, then the app will show that there was a high-risk contact. The app will not say who the contact was with. It will not say where this contact was. It will also not give the exact time. It will only give the date on which this contact has happened, which is needed to determine the quarantine period. So the app is very easy to use. So it may give you on a daily basis some epidemiological information, which is done in Ireland and in Belgium. It will show for most users a low risk. And then if it detects a high risk, it will instruct users to contact a GP or to maybe call a helpline to get further information. And in both cases, of course, if a high-risk contact is detected, you're supposed to get a test. So the last thing I want to explain is that, so at this moment, every country has its own app. Some apps have regional functions, like in Italy, there is a regional function so that you can do some regional management. Of course, if you do this, if you make the app specific per region or collect region data, then you lose a bit in privacy because you give up more data. But so the nice thing is that these apps are based on sharing these random codes, which are actually more or less anonymous. They don't give personal information away. And if you're not infected, you never give any information away. But so because the central server does not contain sensitive data, it's actually very easy to exchange this data among all the countries. And this is exactly the plan that has been made. It was design of the original protocol already in April. So the European Commission has started the European Federation Gateway Service that should go live mid-October. And all the countries can connect their central server to this. And then all the apps in Europe can actually get all the infected codes from all over Europe, or maybe from the countries you visited, you can configure that. And this way, even if you say a German user, you travel in Belgium with your German app, you will get a warning if a Belgian user was infected. So this will go live mid-October for the 4 countries I list here. So Latvia, Germany, Ireland, and Italy. And it's expected that all the countries will join in the weeks following that, so that all the countries here indicated in blue will be part of the system, all 18 by, I would say, mid to end of November. So I think it's a very nice example of each one having their own app with specific features of the national health system or the regional health system, yet you still have a European collaboration. The only limitation of the current system is that if, say, as a German, you travel to Belgium and you would get tested in Belgium, you cannot upload the test results in the German app, Belgian test result in the German app. That doesn't work. So the Belgian health services or the regional health services in Belgium, Flemish, would have to inform the German health services, and then the upload should happen in Germany. But that's because the health systems themselves are different, also different of the app. I think this is what I wanted to say. I believe it's actually a success beyond our dreams. So very often, as academics, we design privacy-friendly solutions, but we see that in the market, another system that's much less privacy-friendly takes over. And here we've seen that by designing something privacy-friendly, actually, we managed to convince population, at this moment 45 million people, to install this app. We see that this app is effective. It's not a miracle, it's not a wonder cure, but it has a contribution. It actually helps contact tracing to make it more effective and faster. And we also see that because the app is so privacy friendly, it's actually very easy to make all the apps collaborate. Because if you collect too much information in such an app, it's clearly not acceptable that nation states or member states would exchange this information between each other. Because the information here is low in terms of privacy sensitivity, it's actually quite easy to just connect. So I want to stop here. Thank you very much for your attention.
Thanks, Bart. Just a quick question. So you have the numbers for the downloads for Belgium, and yeah, it's quite recent in Belgium. But do you have also a view where it's downloaded, or what's the regional uptake? As we know, for example, now the problem are more in the cities.
I think that by design, we don't want to collect this kind of information. So I know that many apps you used to have actually spy on you the whole time. And the technical term for this is telemetry. So you start measuring things. Mm-hmm. But actually, the app we have provides no information on the user. And so if somebody is not infected, your app never sends anything except for random Bluetooth codes.
Yeah.
Or random information. So this is a price to pay for having the privacy. Yeah. I know that in Italy, they insisted on actually having the user indicate their region because their healthcare system is organized per region. And so there it was decided to provide this information in the app. Of course, this can be done, but that means at the other hand that you actually give up some privacy.
Yeah.
And so technically it's possible, but it brings a privacy risk because there is a channel created to a central server where some information on the apps is being collected. So I think the app doesn't need it to function properly. I think if we want to know what the adoption is, because of course we also only know downloads, we don't know installs even, or it's very hard to estimate those. We don't know whether people actually leave it on. I think the best thing is to work with questionnaires and ask people and get the information in this way.
Yeah. I think Cathy Berks has also a question.
Yeah, just a very brief question, and it's for me very nice to see Bart live. It's the first time that I can see him. But there were some issues about healthcare workers. They mentioned that if they use the app, they continuously get red screens due to the fact that they work close together or close to other people, and they also might have downloaded the app. Is there a solution for it, or they only have to switch it off? It's like it's the only question where really are so close to each other that they receive so many red screens or very fast red screens, so that they mentioned, okay, we can hardly use it. Or is it something that can resolve or be resolved easily?
It's a very good question. Again, we could automate this by collecting more information, but we believe we shouldn't do that because some people may not want to use it. Because if the app starts collecting information, whether you're in a bar or in a hospital or whatever, then it would work better. But then I think people may say this app is spying on me and the government is checking how much I go to bars or whatever. For healthcare workers, very specifically, if you're really sure, and I think these people know about this, that you wear protective clothing and you're safe, then the advice is to switch the app off. And this is very easy. You can do it at the Bluetooth level or in the app itself. There is a button. Now, If you're not so sure about the protection equipment, I mean, also something people don't understand for healthcare workers, if you work in a COVID division, nobody should have an app there that actually sends infected symbols out, because once you're infected, you're supposed to remove the app. The app is not there as a spy to check whether you follow the quarantine or isolation rules. Again, if you would do this, it's very easy to cheat and switch off the app or switch off your phone or whatever. So we explicitly tell users, if you have a positive test, you first inform all the others and then you remove the app. And if you're healthy, depending on the medical advice, whether people believe you can be reinfected, you should start using the app again after 2 or 3 weeks. But so a doctor will not get a positive signal from a patient with a positive test. So if he knows positive, then he also knows that the app of this person will not warn him. So that, I think that's the two elements. I think what is still up for discussion or debate, and this is beyond my area of expertise, is so the rules for high-risk contact is 1.5 meters or whatever, or 6 feet, or depending on the country, and 15 minutes. So now what if you wear a mask? Of course, the app doesn't know. This is something that, well, again, you could use a camera, but this is too privacy invasive. So the app doesn't know. But then some people say, well, masks are not perfect. And if masks would work really so well, then I think many countries would have no problems anymore. So I think this is, again, your own judgment. If you feel you're safe, I mean, our university has had in the lecture halls.
Someone, yeah.
We believe we properly ventilate our lecture halls. So we advise our students in the lecture halls to switch off the app. But of course, that's a policy that can be locally set.